everyone, welcome back to Good Morning Mississippi on this Tuesday morning. I'm here now with Dr. Nika Sanders, and she's an OBGYN at Greenwood Leflore Hospital. And we've been talking a lot about diabetes over the last few months here on the Delta on our show. And you deal with diabetes in pregnant mothers. So tell us about this risk factors and where you really see this.
Well, gestational diabetes is diabetes that develops in pregnancy, and we know that you're at risk for glucose intolerance during pregnancy. And so typically what we do at your first visit is just take your history. See if you have any history of diabetes during other pregnancies, if you have a family history of diabetes where it was diagnosed at a young age. And then, of course, we test you between 24 and 28 weeks, which is the 6th and 7th month of pregnancy.
I was going to ask you how many months that is. My math isn't quite there. And so what are some of the symptoms of having diabetes as a pregnant mom?
Well, everyone knows who's ever been pregnant is we check your urine every visit. And so what we do is screen based on those risk factors. So our urine tells us, your urine will tell you if you're spilling glucose or spilling sugar. And so that would raise awareness for us to check you earlier than the 24 to 28 week interval. But what we also know is when you're between 24 and 28 weeks, we give you a glucola test. And that is kind of a sugar rush. So you drink a solution that is very heavy in sugar, and we draw blood about an hour after to see what those levels are.
Interesting.
And if it's higher than 140, we think you have diabetes.
Okay.
And that would give us an answer.
And we were talking a little bit before the break, and when you have diabetes as a mother or as a pregnant woman, you have some risk factors for how you deliver the baby, is that right?
That's correct. So what we know is people who are diabetic are at increased risk for having macrosomic babies, larger than average. So if your baby is larger than 9 pounds, then it puts you at risk for an operative delivery, meaning rather than just spontaneously pushing the baby out, that you may have to have an operative delivery, which includes vacuum suction. Sometimes forceps can be used, or you may just have to have a cesarean if we believe that the baby is too large to pass through the pelvis.
And are you seeing a lot of diabetic mothers in Greenwood Leflore? Do you see a lot of this? Is this really common?
It is common. The incidence is probably about 5% of pregnancies.
Okay.
And so, yes, we see it fairly often.
And what is your main line of defense? Do you really try to work, educate mothers right when they come into you at, I guess 6 weeks or whatever, and say, this is now something you need to think about, eating healthy, being active. Is that a prevention technique, or is it too late at that point?
Certainly. Well, it depends on whether your diabetes is diagnosed during pregnancy or whether you knew you had diabetes before pregnancy. So let's talk about, say, if you were diabetic before pregnancy. If that were the case, then what we do is counsel you before pregnancy to make sure that your sugars were well controlled. And we do that by checking a hemoglobin A1C. So that measures the amount of sugar that's in your system over a 3-month period. And those levels should be about 6. Now, most diabetics, and by diagnosis, their levels are elevated, probably about 7 or 8. And so for pregnancies, we're very strict because we know that it increases the size of the baby. Now, if you're diagnosed with diabetes during your pregnancy, what we do is we do diabetic education. So we'll send you to a diabetic educator that's located at Greenwood Leflore Hospital, and they will teach you about nutrition and how to count carbohydrates and reduce your starches during meals to ensure that you have a balanced glucose level, and also to be sure that those levels don't rise so much that they impact the baby.
And if you get this diagnosis, is this something that people should be really worried about, or is it basically you can still have a healthy baby?
Oh yeah, you can still have a healthy baby. We can manage it. Part of it is just being diagnosed and learning what to do to ensure the safety for you and your baby. So it's easily managed with education.
Well, wonderful. Everything, I think, is managed with education. That's kind of our philosophy here. So I'm glad to bring you on this morning and maybe talk about a topic that people are not aware of. So we thank you so much for being on here this morning, Nika.
Thank you.
We'll be right back.
The diabetes segment is brought to you by Greenwood Leflore Hospital.